Heidi, will you please resend the doodle? I mean, you'll have to update the dates. And then I wanted to make sure that everybody read the information that Jane Ellen shared and review the budget before we come together with a letter.
Yep. Okay. Let's call this meeting to order. Introductions. We have one guest. Is that Judy? Hi. Hi. And now I'd like to adopt the agenda. So I need a motion.
Hi, Commissioner Adams. Make a motion of the minutes for,
Not the minutes. We're getting the agenda.
oh, I'm sorry. Yeah, the agenda.
Okay.
I'll second it.
Thank you. Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay. Review and approval of the September minutes. Do I have a motion?
So moved, Colonel Mayor. I'm sorry, Commissioner Mayor.
Hi, Commissioner Adams, second that for the minutes.
Any discussion? All in favor?
Aye.
Any opposed? Announcements. Are there
Commissioner
any?
McEwen, I just wanted to mention that you'll see that the minutes look a little differently and we had to reformat them for accessibility purposes for our website.
Okay. And Randy just said that she is checked in. Glad you're here.
Ms. Chair,
Yes.
this is Commissioner Adams. I would make a announcement that my charging stations idea here in Jackson County has gone now from 157 charging stations to now 175. And Josephine County will be getting their funds to now having 12 charging stations in Josephine County and Grants Pass, and now 2 in Brookings.
Great.
That's fantastic, George.
Okay. Any other announcements?
This isn't an announcement, Ruth, but responding to George, what George has said, it'd be great to highlight what you're doing, George, maybe in the commission newsletter or the Home Care Commission newsletter or something. That's wonderful work.
How do I do that?
I'll follow up with you.
Okay.
Okay. Any public testimony?
We do have public testimony. Let me read that. Okay. Begin testimony. Full disclosure, I am an SEIU Local 503 board member and a member of the Home Care Bargaining Team. I am not speaking for the union in any capacity. Questions in this testimony are not rhetorical and require an answer from the OHCC. Employees of the OHCC enjoyed the Labor Day holiday by having the day off and receiving holiday pay. If it weren't for care providers, they would not have a job. On the other hand, care providers did not have Labor Day off, nor did they receive holiday pay. Some care providers worked on Labor Day and got paid time and a half for up to 8 hours of work. By the way, it takes a month for care providers to receive the 0.5 hours on their paycheck. How long does it take for OHCC employees to receive their holiday pay? Before you present the excuse that this is a matter of bargaining, answer the question as to why this situation exists in the first place. Why would the state treat a group of workers this way? How long before the state does the right thing and give care providers the respect they deserve and treats them the same way OHCC employees are treated when it comes to holiday pay? OHCC needs to respond to the above during this meeting. Care deserts. There are many locations where there are not enough providers. If a provider could get mileage for working in a care desert, this problem could be alleviated. This shouldn't have to be bargained. Karina is not helping. DHS/OHCC needs to reinstate the old system of the local DHS offices having a list of care providers in their area to give to consumers. OHCC needs to respond to the above during this meeting. When a PSW works through an agency, who is responsible for giving the care provider their task list? Who is responsible for determining how many hours of care the consumer receives? OHCC needs to respond to the above during the meeting. Time is of the essence. Now that the OHCC and DHS has been made aware of their shortcomings and failures in a public meeting, they cannot take the position they did not know. Testimony respectfully submitted by Avery T. Horton Jr., home care worker, citizen, voter, taxpayer, State of Oregon, as always, acting in an individual capacity. And a testimony. So here's the information I would like to share. It's in Oregon revised statute that the home care workforce they're not state employees and they're not covered under the collective bargaining agreement for state employees. Any benefits are collectively bargained. So it's not an excuse, it's the actual reason why pay for holiday pay is part of bargaining and that the home care workforce are not considered state employees. So I don't have much more to offer than that. In terms of the PSW information, I did clarify with the Office of Developmental Disability Services the information about task lists. They don't use the term task lists. Those are used for home care workers and personal care attendants. They use service agreements, and the case manager or personal agent provides the service agreement to the employer for signature, and then it gets routed to the personal support worker, either by the employer or the case manager. And the assessment determines the number of hours the person is eligible for overall. And then the personal agent and the person and people the person invites determine how many hours are assigned to each provider or provider type. And then in terms of the registry, I will just mention again, the intent of the registry, even the OHCC registry, was not to provide a general list of providers to consumers. It's a matching system, and we want people to put in individual information into the system so that it meets the needs of the person who is looking for services. In terms of mileage and care deserts, again, that's tied to collective bargaining. Any benefits are tied to collective bargaining. So those are my responses.
Ms. Chair, may I add to
Yes,
Jenny?
yes.
Okay. Since we're on record, there was a consumer that went on to that new registry. And when it was handed to her by a case manager, there was no phone numbers on the list that was given to this consumer down here. So she had no way to call a provider on that new list. Is there anything we can do on making sure that there's phone numbers on that list?
You want to take that one, Jenny?
Yeah, it shouldn't be a list, and it may be a user error. So if you happen to email me the name of the individual, we can follow up with that person.
Okay. I will talk to the consumer and see what I can do.
Great, thank you so much.
No problem.
Judy, do you have anything?
Not on that matter, I do not.
Well, I meant for public testimony.
Oh, no, thank you, Ms. Chair.
Okay.
And
Yeah.
Commissioner McEwen, we also have another guest, and I'm not sure if she has public testimony.
Okay, I didn't see, I don't,
Pat, Patty.
okay. Patty, do you have anything you want to talk about?
Good morning, folks. I'm just here attending, but thank you for asking me.
And are you with a group?
I'm with a couple different groups. Today, I'm here as part of the Governor's Commission on Senior Services.
Okay, thank you. Glad you're here. Okay,
I should
then,
welcome, Madam Chair, I should welcome a fellow commissioner from the Governor's Commission on Senior Services. So welcome, Patty.
Hey, Mary.
Hi.
okay, do you have a report for us, Mary, from the Governor's
Yeah.
Commission?
Yes, I do. The Governor's Commission on Senior Services is sponsoring a webinar put on by the Oregon Gerontological Association. It's their 2020 conference, and we have two invitations to attend these virtual conferences. And so I am going to be one of the two. I don't know who the second one is yet, but the topic is engagement, enhancing connections as we age. And it's the first one is going to be October the 4th, and then the following 3 Thursdays. So it's about 3 hours in the morning. And I'm very anxious to see what this webinar is all about, and maybe I can bring back some slides or some information, when I finish up all of those. So that would be at the end of October. So hopefully in November, I'll be able to report both to this body as well as the Governor's Commission on Senior Services. But that's my report.
Any questions for Mary? Oregon Disabilities Commission.
Yes, I do. We had a two-way dialogue and feedback on the Universal Accessibility Advisory Committee with David Morrissey and Laura Whipper. We had Matt Raposa on how APD interact with consumer with undiagnosed and hidden disabilities to assist them in recovery services. And with Jamie Tilford, we have home care workers and personal support workers paid for services while their consumer employer is in the hospital. And that's all I have to report.
Okay. Any questions for Mark? Okay, the Oregon Association of Area Agencies on Aging.
Good morning, everyone. I'm going to turn on my. You can probably hear I've been fighting a bug. So have an ear infection and just don't feel real great this morning, but happy to see everyone. Just a brief update. I wanted to let you know that just last week, actually, these are the people who probably got me sick. The O4AD, the Oregon Association of Area Agencies on Aging Directors, got together for their annual planning retreat. We spent a good couple of days together talking about area plan development, pain points that are happening for all of the area agencies on aging, and trying to figure out how to work together to, tackle some of those kinds of issues, such as workforce, struggles with programs that have been launched and, maybe are not going as smoothly as we hoped. We talked a lot about the legislative session and our goals for that, what we might be doing for advocacy for that coming legislative session. It was really exciting that we had Louise Ryan, who is the Administration on Community Living Administrator for our region, come to our strategic planning event, and got to spend some good time hearing from her what's happening on the federal level. Sandy Mirkwood, who is the Director of U.S. Aging, which is the National Association of Area Agencies on Aging, has come to this conference in the past. She wasn't able to make it this time, but she's actually going to come in a couple of weeks, or maybe next week, whenever the date is, to the quarterly, which I'm going to tell you about here in a minute. So the strategic planning retreat was a great one. If you have contact with the director of your local area agency on aging, I'd encourage you to ask them about, like, conversations that happened at that event. Another big thing is that we talked quite a bit about emergency planning. I think most of the area agencies on aging plan on have some level of strategic planning in their area plan over the next 4 years, because we all know that that's such an important part of serving vulnerable adults and people with disabilities. Let's see. The other thing that I just wanted to mention really quickly is that October the 15th and 16th is the quarterly O4AD quarterly information session. I'm blanking on what it's called, but it's our quarterly meeting. It is in Salem in person. If you don't know how to register for that, let me know and I will make sure that you can find out about that. We definitely love to have advocates as part of that meeting. So that's just a couple of short weeks away. So we're looking forward to seeing everyone at that meeting in a couple of weeks. And I'm happy to answer any questions if you have any.
I have a question for you. Who is going to be the head of the directors now, with Tanya being gone?
Well, I was going to actually also make an announcement, but I decided it maybe didn't pertain to everyone. But yes, I would like to let you know that Tanya DeHart, who's the long-loved director of Northwest Senior and Disability Services, lucky dog, got to retire. And so we wished her well. I unfortunately was ill, so couldn't come to her party, but her last day was on Monday. We hope to see her around still. I don't think she's done good work for our state, but she has retired. We have, Ruth, you're gonna put me on the spot. I was starting to feel a little bit like I had a cold right then. Dan Curtis from CAPCO is going to be stepping in the role of, Irma Jimenez, there we go, is stepping in as the role of interim chair for just the remaining term of Tanya's term. Cassie Regenbald from the Central Office on Aging is going to be continuing as the vice chair, knowing that she'll move up in the next round probably. And then Dan Curtis moved into the treasurer position, I think is what happened. I can confirm that for you and get it in writing, Ruth, because that was a little vague. I'm trying to remember now.
Okay.
That was a few days ago and a lot of cold medicine, but I'll get you the information.
Okay, thank you.
Yeah.
Okay. Self-advocacy coalition, do we have anybody there? Okay, let's move on to aging and people with disabilities. APD.
Yeah, good morning, Ruth, and others. I have nothing to report at this time in regards to major activities in APD. There's a lot going on, but nothing to report at this time.
Okay. Do you have any insight into what's come out of the symposium? And how will that affect seniors and people with disabilities?
Unfortunately, no, I don't have any information to share on that.
Okay.
There could be a follow-up maybe next month, possibly, but I would probably defer to JD Tilford or Matt Raposa, possibly, to provide that information since I wasn't directly involved.
Okay. And community advisory councils, coordinated care organizations.
Yes, this is Commissioner Adams. There's nothing being reported on the CACs, but on the CCO side of things, on the NEMT committee that I'm on, we have done our first phase on medical transports underneath all the CCOs through OHA. So now we're going to be going into our second phase, which will be next year. And there's a lot that we are working on to make medical transports underneath these CCOs better than what they were before. That way consumers are not having to wait for their medical rides after their doctor's appointments. Trying to squeeze them in where there's not too much minute gaps. Say like if you go to the doctor and you're done with the doctor and you go to call your provider to come pick you up, you're not gonna have to, we're working on the consumer not having to wait an hour or to wait an hour and a half on a ride to get back home. That's what OHA's and the committee itself that I'm on is trying to work on to make it more smoother for consumers, which will make the CCOs more happier because then they won't get so many complaints from the consumers into the CCOs about the medical aspect of this stuff. And that's all I got to report on that.
Okay, are there any other reports? Okay, Gwen, you're here. Gwen, are you available to start?
Let me message her. Maybe she's having difficulty with her microphone.
Are you able to hear me now?
Yes, yes.
Sorry about that. I'm just gonna go off my laptop audio. It doesn't want to cooperate today. I can just give a quick update. Thank you all for having me today. My name is Gwen Ayers. Allison Vidari is the other communications person for PTC, but she's out today. She's having family visit, so today from the Midwest. So that is awesome. So I'm going to just give a quick update. So PTC phase 2A is what we've discussed a few times here, and that has been implemented successfully. It started to be implemented on July 19th, 2024. Entries worked before July 27th, 24 are being pulled into payroll batches daily by the PTC support team. And these are being emailed to local offices daily for manual entry into the payment system. There are only around 200 or so of these entries each day, and the payroll batches continue to get smaller and smaller. And so this means that there is less and less reliance on manual data entry, which is prone to error. So then in terms of the time and mileage entries worked starting on July 28th, 24, those are being sent automatically to the payment system instead of being manually entered into the system by local office staff. And the automated pay processing has been going extremely well. After discovering just a few unexpected errors at first, the team who works on the state's payment system and the PTC team have been able to make sure every provider who made correct entries by the deadline was paid for those entries on time. And then we've been sending the pay files to the payment system according to the deadline and the collective bargaining agreement, and that's been going great. The local offices hadn't always necessarily been going by the CBA deadline prior to the automation, so we had a few questions about that at first, but it seems like folks have adjusted well. We've made sure that that was clear through different communication efforts to providers and staff, and really haven't had any questions after that kind of initial adjustment. So So yeah, that's pretty much an update on phase 2A. Things have been going really well so far. Are there any questions?
Yes, Gwen, this is Commissioner Adams.
Yes.
A question was brought up to me by a provider, and I had no answer for it. How fast can the checks get to providers from this phase 2 that was put into place?
It's nothing about how the checks are sent is different. It's basically we go by the CBA deadlines for time entry. So basically 4 days after the end of the pay period is when we pull in the entries, and those will go through for pay processing on the pay processing date. And that's really this should be the same process as what was being happening in the local offices. And it kind of varied based on local office, because sometimes folks would not necessarily kind of enforce that deadline of 4 days after the pay period. They would take additional entries that were entered late and put those to be paid at the same time as the on-time entries, which is something that's just can't possibly be done anymore because of the way it's centralized and automated. So it's kind of hard to answer the question of how fast they get the check, I would have to say, because it kind of depends on whether they're entering it on time and how, there's nothing really different about the checks themselves being cut and things like that.
Commissioner Adams, there is a payroll calendar for the workforce, and it says when the pay processing date is, and that's when checks are mailed, and also the payment files are sent to the state's bank to go into the providers' banks. So that has not changed.
Okay. And another question I wanted to ask, how many phases more is coming through the PTC?
Yeah, so the other phases that we are looking at for the future, so as you know, we just had phase 2A, and then phase 2B and 3 are kind of going to be combined in a way. And there's really not going to be any visible changes for folks who use the system with those phases. With phase 2B, we're just going to basically have the systems on the back end talking to each other more, so that we have less manual work that's being done on the PTC teams side of things, because there's a lot of manual work that we have to do every day to make sure that new consumer and provider profiles are being set up. Those are practically being done manually every single day. And so that's something that because of the way that projects, they kind of like the team and the funding, the resources, they go down over time. So we have to make sure that we're taking those type of things away from the PTC team over time, so that we have enough people and resources to keep the system going, essentially, and maintain everything. So those kinds of things are going to start going away. And then with phase 3, it's basically data aggregation. So we're going to like other agencies and groups that use that have data is going to be able to be pulled into PTC, so that PTC can process it and again, it's just going to reduce manual work for other teams and groups that are currently outside of PTC. So it gets a little more technical and not as obvious, the changes that are going to occur for staff, providers, consumers, etc.
Okay, thank you.
Yeah, absolutely. Any other questions? All right, well, thank you all so much. I appreciate it.
Well, thank you for the presentation and keeping us up to date.
Absolutely. Have a good one.
Okay. David, are you with us?
I am always with you. I am like an omnipotent presence around you.
Okay. You want to start? You want to start your presentation?
Yes. I will. Thank you, everyone. I am the David Scott Vining Program Analyst here with the Oregon Home Care Commission. Just want to give you an update on where we're going with the strategic plan, how it's moving forward. We've got bits and pieces of it going forward quite a bit. The communication plan is being worked on by our comms team at APD. Adrian Goings has been helping me with that. Gave me some insight into our social media presence. So we'll be, our own Miguel is going to be taking over some of the Facebook stuff, helping me out a lot with that. We're trying to build up some traction there. We've already got a few thousand followers. So want to get into the algorithm right a little bit better. So Miguel and I are coming up with a plan for it on what to be posting. So we're going to be posting every day on our Facebook, just a little thing, not including like immediate needs, right? So every now and then there's an emergency that we post about. I'm looking at Corey and all of a sudden I feel like I'm talking too fast. I'm sorry. Um, uh, back on track. I'm there. Yeah, so we'll be sharing from ODDS. They have a Facebook page that we'll be sharing from. Miguel and I will also be scouring for fun articles that are important. I was coordinating last week or the week before was Fall Prevention Week, and so I had coordinated with the team on health and safety at ODHS to send out text messages, but I already have them thinking through next year so that we can have social media cards for like that entire week. So Miguel and I will be planning out like special month and all that stuff to find things to post. And as we're doing that, we'll be getting into people's feeds a lot more and asking them to share if they know other providers so that we can begin to build out that network of providers even through Facebook. I do have an ask for all of you commissioners. Paul, I know you and George like to send us articles every now and then. So anything that you think might be really good to go up on that Facebook page, always welcome. Please just email that to myself. Jenny can even forward them to me, I guess, or Miguel as well. And we'll be coordinating getting all that stuff up. Yeah, any quick questions about that? I'll just pause at different points.
Yeah, David, this is Commissioner Adams. Is there any access for us commissioners to see that type of stuff on social media? Do we have to add you as a friend on the friends list, or how does that happen on Facebook?
Yeah, if you just go and follow the Oregon Home Care Commission on Facebook, you'll see the stuff that gets posted.
Okay.
David, this is Paul Johnson. Interesting information. There may be some other things that I'm ignorant a little bit that we could, and maybe they're already included on the Facebook page. So, Jenny wrote a really good summary of the Home Care Commission a while back that I believe was put on the Home Care Commission website. Kind of an overview, really good. There might be some things that are currently on the commission website that could be brought over on the Facebook page. I don't know. I'm speaking outside of my area here, but just making the suggestion.
Yeah, thanks, Paul. That's a great idea. And I'll go through and see what we can get and post over there. And continuing to, that brings to up a next point, our websites. Both websites are continuing to be, we like to finalize them and make them as smooth and user-friendly as possible. So the ODHS one, we're constantly looking for things and what to do there, especially since we anticipate traffic going up there, right? With the Facebook page getting a little bit more traction. Am I saying the word traction too much? But yeah, we'll be getting more traffic. We'll use a different T word over there. And so wanting to make sure that it's smooth and really easy and accessible. So I constantly work with our SharePoint team to make sure that that's looking good and everything's up there. Our workforce development website is going to be getting a little bit of a makeover. taking some stuff down, streamlining the process for people that want to be applicants. So that's a big deal because we're going to be launching the big media campaign soon, this workforce, to hopefully bring in a lot more people. So we want to make sure that that workforce development website is really smooth, really nice looking, and as up to date as possible with everything. And that coincides with our DocuSign stuff. We've got, oh my goodness, every now and then I just realize how much we've got going on. So DocuSign is getting ready to fully launch statewide so that people who want to become home care workers can apply right there online, and their application will be sent to the local offices for a much faster process for getting into the system. They still need to go in to the local office with identification forms for the I-9, identification things for the I-9. But other than that, it's way faster. It reduces errors because people are able to type. It checks their email, making sure that they're entering a valid email address, phone numbers verification. All of these things just happen right there inside of DocuSign. And it's a nice way to allow people to really quickly see if they have the technological skills that are needed for this position now, right? We know that with EBV, just like Gwen was saying earlier, it is a skill that people in the workforce need to be able to have. But this is a real quick way to let people see, oh, I will be needing to use my phone or my computer for stuff like this. So it's a good way to give that in. Also with social media stuff, Miguel and I are kind of thinking about maybe how to do an Instagram and what that might look like for the Home Care Commission. Since Instagram's more of a photo thing, we're going to be kind of brainstorming about that and really thinking through that stuff. But Miguel's actually already got ideas for it. I couldn't crack that code, so that's pretty awesome. Jenny, I saw you come off mute. Did you have something to say to me?
Yes, I think since we're relaunching our social media, it's also an opportunity for us to educate people about the commission and what we do. So not just, sharing articles and things like that, but saying, hey, did you know blah, blah, blah about the commission?
It's a great idea, Jenny. We'll do a Facebook Live with Jenny.
I'll do it.
I don't know why you laughed at that. I saw someone's hand go up first, but Paul's is up at the moment, so.
So again, ignorant regarding this particular service, but I wonder if it would be possible, at least we could explore possibly something like LinkedIn or some other service, some other online, I don't know if you call that social media, probably not. Anyway, advertising opportunities to work with, as a home care worker, et cetera. Again, I don't know if they do that. I know that they help promote people's backgrounds and so forth. I don't know if they would do organizations or state organizations, but it's just a thought if we haven't come that, if that would make sense, if it's allowed to, LinkedIn or maybe even these other, again, ignorant about these things, but Indeed or some of these other major job sites. Again, I don't know if they allow advertisements or publicity, but if we haven't explored it, at least we can find out the answer to that question and possibly find a new avenue to be promoting for the workforce some opportunities.
Yeah, thank you, Paul. It is something that we'll be looking at doing during the media campaign, with just targeted ads for different population groups, but also putting up their little banners that people can click directly to the website and find out about us more. Yeah, this is definitely something that's been talked about and discussed.
David, this is Commissioner Adams again.
Yeah.
Can you give us commissioners if there's been an increase or a decrease on the number of people applying for caregiver, being a state caregiver? Or do you have those numbers?
I don't have them in front of me, but I can find those for you, George. We can discuss those.
Because I'm pretty sure the other commissioners are kind of curious about it too.
Commissioner Adams, that is definitely something we'll be tracking so we can see the success of the media campaign and our provider navigator program to see how many people are coming into the workforce and how many people are finding work and staying in the workforce.
Okay,
Plus that
More
data,
stuff. Oh, sorry.
plus that data will be of value to the agency with choice committee in forming what they're getting together for the new program that was put through in the last legislative session. Go ahead, David.
Absolutely. And then another point on our comm stuff, we'll be starting our Power Hour, getting that back launched again. Roberta and I are looking at November dates to have the first one to again continue to reach out. And this one will be about helping providers. The topic I think we decided on getting onto PACE so that you can take our courses and certification. But it'll be something that we promote on Facebook, that we email out and send out to make sure that we can get more people there and help people through the problems and let them get to know us as staff and the commission and what we offer them. Whew, that's a lot. Next, we're working on what we might need here at the commission. So we're doing some program analyzing stuff. That's, I guess, my forte. It's technically my job title, so might as well do it, I guess. We'll be holding interviews. Kelly and I, Kelly Rosenau, graciously offered to help me. So we'll be doing interviews with the staff here to find out what they might need to help better serve our consumers and employers and the providers that support them. So those interviews will be starting here next week. Kelly and I will be doing the first one together, and then we'll start reaching out to the rest of the staff to interview them and get their feedback on everything, which will be fun. Paul?
Yeah, so it's an interesting topic. So along those lines, and maybe you were going to address this as well. So I don't have the strategic plan open in front of me, but I believe some of the things that we looked at when we were putting it together and working together is we were talking about maybe some new focuses that the commission needs to have in order to effectively reach out to, for example, the legislators, other commissions or committees that we have a mutual interest with, and things like that. Are you anticipating a survey of those strategic initiatives or ideas and factoring those into future staff or adjusting staff assignments so that those strategic initiatives could also be pursued?
That is a great insight, Paul, and I'm going to add it. That's what I'll say.
Because if we don't, I think we had some great ideas. I really enjoyed that process. I appreciate all that everybody contributed. But we were talking about new things, and new things only happen if there are, number one, people, and number two, funds to help make that happen. And I just wondered if that's being factored in when we're talking about maybe reshuffling some assignments and or adding new staff. I realize that's not an easy process sometimes, but we need to look at those things that we were saying are priorities and see if in regards to a strategic priority, and then see if we have staff and finances dedicated to make those things happen.
Yeah, thank you, Paul. And definitely, I always tell Jenny what she needs to add in any pops that she's asked to do, whatever they stand for. I can't think of the acronym all of a sudden.
Policy option packages.
There we go.
Yeah. So one of what David and Kelly are doing is also asking staff, basically, what is the effectiveness of the program? Could efficiencies be made? How do you think things are working? How do you think things could work better? So that we have a better understanding of all the programs and, what changes could be made. And then we could look at seeing, could things be shuffled around? But just starting with that analysis of what we have right now and what needs to change. I think adding staff, although I would love to do that, is probably not something we'll be able to do.
Yet. We're hopeful, right? We go
We-
on with hope.
Yes, we will be hopeful.
Well, I think that will come easier too once we get ourselves together and we can do a better presentation to the legislature so they better understand the need, that more staffing would come with that whole concept.
This is me virtual high five or clapping for you first, Ruth, and then trying to find the high five.
You know, and we've also talked about too, and I understand the staffing situation, but you know, well, I'm an APD employee, so I'm not a commissioner who receives services or whatever. But you know, maybe even I know that many of you are involved in very significant ways. You know, but maybe even trying to mobilize the commissioners in new ways, possibly. In other words, it doesn't just have to do with the staff. Maybe an evaluation
Right.
of you know, what are our passions or abilities or interest, or what connections do we have, or what opportunities are being presented, you know, and so let's mobilize the commission too, to the degree that that's possible, to supplement or complement what the staff are doing.
Yeah, that's great. And I think, David, in the beginning, that was one of the things that we were going to do too, is asking, or I think you did ask the commissioners what they might be interested in helping out with.
Yeah, absolutely. And as I come across those with everybody, well, and we can always come together again to talk and do things. I'm always for that, based upon our availability and everything, to continue to support this important stuff.
And David, this is Commissioner Adams. With the stuff that you're doing, I want to say that you're doing a good job. Also, have you considered the color of your background of your website or on Facebook? Color seems to be drawing people in. And I would think that with what you're doing, if you add a little color, maybe a light beige or light blue, that might help a little bit.
Thanks, George. I appreciate that. Yeah, we'll do whatever we can to make it as attractive as absolutely possible.
Hey, David, I had one more comment, if I may. Sorry for speaking so much. I just am excited about the strategic plan. And I'm going to defer to Ruth, but I'm making a suggestion if it resonates with her or others. For me, one of the things that would be helpful when we do the reports on the strategic plan would be to have something in front of me that show, because I believe we identified some timelines or some dates that, for particular goals. And if I had something in front of me that showed kind of what was on the horizon, what was, you know, this quarter, what were we saying we wanted to do, and how are we doing in regards to achieving that goal or that making progress. For me, again, speaking personally, it would be great if, and I know your workload sounds pretty intense, and so I'm not interested in adding something heavy to you or to anyone else, but that would help me to be able to see, because I don't have the plan in front of me, and to have it on one page in some type of chart or a record, so that we could say, hey, looks like we need to really focus on this, or this is going well, or whatever. I'm just suggesting that may be helpful as we review every couple of months how things are going.
That sounds great, Paul. Yeah, I can move forward doing that with everyone, or for everyone, not with everyone. Unless you all want to with me. But then you have to hang out with me more, which is fine.
Okay, is this agreeable with the rest of the commissioners that we request that David supply these documents for us?
Yes.
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 Yes, Marcia, and I'd like to participate in some of this. The development is one of my sweet spots. But yeah, I'd like to hang out with David more.
Got one.
Okay.
Okay, thank you. And thank you, David.
Yeah.
My pleasure. Thanks for having me, everybody.
Marcia, did you have something more?
I was looking forward to seeing our strategic plan in a visual, something visual so that we can, it's hard to see where you're going when you're just reading lines of text.
Right.
So yeah, that's my sweet spot.
Thank you.
Ms. Chair, I'd like to ask Ginny a question.
Yes.
Ginny, has there been any thought as to a phone number, a faster phone number for consumers to call where they can speak to somebody and not have to leave a message to the Home Care Commission?
Thank you for asking that, Commissioner Adams. It all comes down to the number of staff we have and the ability to answer phones live and returning messages. So I would love to say that we could have a dedicated phone number that somebody would answer live every single time, but the number of calls we get every day we would not be able to do that.
At this time?
At this time, until we were able to have more staffing or dedicated staff just to answer phone calls, but we get hundreds of calls.
Okay.
I would like to see a way to contact for commissioners, a smoother contact. If I don't get Heidi, and she is a busy gal, I have trouble when I leave emails and want to contact other staff or people that, well, other staff getting a call back.
Yes, for the commissioners, we could come up with some sort of triage plan. If you're not able to reach Heidi and you're not able to reach me, that we would have a couple of other people that you could reach out to.
And they seem to be in little isolated islands. And you can't get at it.
Yeah, so the commission has a lot of different work that we do, and I'd love to say that we can answer phones immediately, but that's not realistic at this time. I mean, I would love to be able to say yes, absolutely. But so even if this person is in another area of the commission, they could still talk to you and provide whatever information they can or find the information for you.
Yeah, a way to get, if not direct contact with them, to get at least know that you have reached, with your email will have reached them and get a response back when they can, but not let it go just floating away.
Right. Yes, we definitely should be following up on our messages and emails.
Well, and this too is now more fodder that we can put in our letter to the governor on the budgeting. And these are the kind of issues that we need to make sure that the governor's office understands what our needs are and make sure that we are viable to the public. We need certain standards. And I think that we're getting to have a pretty fair sized letter, I think, to the governor, because we've added a few more things to our parking lot as to what we would like to communicate with her. So I'm glad we've had this discussion because I think it's really helped us zero in on some more things and just getting us ready for this letter and presentation to the governor's office.
Ruth, though, and I'm not sure what the current status is, but I think there's some, so time is of the essence here in regards to that communication, I would assume. Basically, after after November 15th or even before, it's kind of a wash until January in regards to getting people's attention and so forth. I just don't know what, and then the legislative session beginning, I just want to make sure we're keeping our eye on the calendar and on the clock to submit information so that it's seen as a priority and it's given the attention that we hope that it will have.
Okay, the governor's has to have her budget on December 1st. So we still have time for input there.
Okay, so just an ignorant question on my part again. I think it would be great then for us to set a date on when that letter needs to go out.
Yes.
Because if the budget's decided on on December 1st, then it's really decided before then. Obviously, you have the Thanksgiving Day holidays, and so I would imagine in early November, again, just summarizing that things are being discussed rather diligently by that office, by the governor. And if they don't have the information we're providing way well before then it won't be factored in. Maybe I'm incorrect, but I just think we need to probably get that out sooner rather than later, if possible.
Yes, and I shared this with Jenny before, that on top of that, there are 2 other budgets coming out too. And you're going to have the co-chair's budget from the Ways and Means. And so we need to make sure that the information that we get to the governor's office on the budgetary needs for the Home Care Commission is also gotten to the legislatures.
Yes, yeah. One other idea, forgive me, it just seems like they're coming to me right now, and so I'll mention it.
Okay.
Before the session starts, it might be interesting. I would love, not myself per se, but others possibly, it would be great if we could reach out to current senators or representatives who have to do with, who are involved on committees that interest us in regards to senior services and things like that. Invite them to a commission meeting or invite them, maybe go visit their office informally and just make a connection and so forth. Again, we forming those relationships. We talked about that and before the session begins, even trying to establish something in regards to communication or some type of information possibly may be worth our time and effort that we could build upon during the session itself.
And this is very important now after the election, because we're going to have new legislators that don't have the foggiest idea who we are or what we do. And so we need to get the materials together to make sure that they understand how important what we're doing is.
Could we go bearing healthy snacks that they could put in their drawer and remember at different times when they pull it out where they got it from and what we're about?
Marcia, I have talked with Jenny on this a little bit, and we're looking at maybe the possibility of setting up something like what Northwest Senior and Disability Services do in their profile book, only getting the information together so that it could be taken to each of the legislators or emailed to them so that they would have a better understanding of what the Home Care Commission does.
I would favor also sending a Little Lois peanut butter cookie. Those are always effective.
Okay.
All right. That's Paul's signature item. Mm-hmm.
This is Jenny. I just want to comment again, like if this letter is a priority for the commissioners, that you respond to the meeting requests, because this is going to be coming from you. So if not everybody wants to participate in that, that's okay. But if we have at least a couple of people who are involved in drafting that letter, and then everybody can review it. So if this is a priority, please respond to the doodle poll for a meeting.
Okay. Message
And
received.
if you're having trouble responding to the doodle poll, if you could just email me or call me, that would be fine too.
Heidi, I don't even know if I responded. It's been pretty busy. on my side. But so let me know, otherwise I will quickly respond.
Thank you.
Can we work first before we sit down and try to write a letter? Develop an outline?
Well,
Or,
that's what the purpose of this meeting is.
oh, not to compose the letter.
Well, this is what we want in the letter. That's what we're trying to figure out first.
Okay, thank you. Now I understand better.
Okay.
Mhm.
Okay, our next speaker is here. So, Phil, are you ready?
I am. I am going to try turning on my camera and we'll see. On all of the meetings I've been on today, everybody's been having issues. So hopefully it was a previous connection. So good morning, everyone. I'm Phil Warnock. I am the director for the State Association of the Area Agencies on Aging, otherwise known as Oregon Association of Area Agencies on Aging and Disabilities, O4AD, because it is a mouthful. So I'm glad to be back here with you all. It's been probably a year, I'm guessing, since I last joined and shared any sorts of updates. So I'll just start off with a little bit of a description. Our state association is made up of the 16 area agencies on aging across the state. There's different kinds of structures. The Type A AAAs focus primarily on older programs, and we have a couple of AAAs that are Medicaid AAAs and do eligibility determination, and all of the long-term services and supports services for Medicaid recipients. So that is how the AAAs are structured and comprised, and we as an association provide a lot of the kind of advocacy coordination and streamlining of issues that are of importance to all of our members, and then work with the state on kind of trying to find solutions, resolution to issues, and that really ranges from everything from technology related to policy related, and of course
You're breaking up, Phil.
Okay, I'll try turning off my camera, see if this gets better. Give it a second to stabilize.
You're stabilized now.
Okay, perfect. So that ranges, what I was saying is that ranges from everything from technology issues that affect the area agencies on aging, to policy, and of course funding issues, especially around funding for positions and the services that the AAAs deliver directly. So I saw that the concept or the topic that was listed for our engagement today was specifically around our work with aging and people with disabilities, so APD. I did want to just ask kind of any sort of clarifying, was there anything in particular you wanted me to focus on for our conversation today?
Does anybody have anything in particular they want to hear?
I do have a question. This is Commissioner Adams.
Hello, Commissioner.
With the DSACs around the state, you know who they are, right?
Yes.
Is there any way, I don't know who's in charge or who makes the decision on it, but I was wondering who decides on the amount of money to give out to DSACs on their budgets?
That's a great question. I don't have a direct answer, but I know that Joseph Lowe is the coordinator, kind of the staff policy person for the DSACs from the state. That would probably be a good question for Joseph to address. I know Nicole is going to be on here in just a little bit, and she's more plugged into kind of the funding mechanism decision process. So she may be able to provide a little bit of insight, but I would probably reach out to Joseph Lowe for additional information on that. I will say that that's a great starting segue that I can expand a little bit on the answer and say that O4AD does host quarterly meetings where two of them post-pandemic, two of them are held virtually in the winter and summer for scheduling and travel considerations, and then two of them are held in person in the spring and fall, and we're coming up on our fall quarterly on the 15th of this month. And as a part of that, this month we actually have our National Association Director or CEO, Sandy Markwood, is going to be coming in to present some information for our morning plenary session, and then is going to meet with our advisory councils and advocates in the afternoon and provide a bit of an Older Americans Act 101 type of presentation and talk a little bit about the roles of advisory councils from the older adult perspective and OAA. But Max Brown from the state is also going to be participating and talking about the kind of the history of DSACs and their role and function in that afternoon session as well. So that will be an opportunity maybe for some engagement around the history and role for DSACs.
Hey, Phil, this is Randy.
Yes.
A couple of things. I'm the one who said, you know, it might be great to have Phil come and visit because it's been a while. I think there's a couple of things going on. I think what I was mentioning when we said that it might be good to have you come visit is that the legislative session is coming, and we know that O4AD has always had some work that we've done around advocacy. APD has their work that they do around advocacy for programs. So how to make sure that those are not maybe not always aligned, but what our plan is for working forward for making sure that the needs of the people we serve are met, and how we work towards that as we move towards the legislative session, as well as when we have big programs like OPIM rollout, like what the coordination with APD is and how that works, how we work together to try to make sure that those programs are managed, because there's a policy piece in APD and then the actual implementation of the plan that happens through the area agencies on aging and APD offices. But we are the majority of the folks who, like, for example, OPIM are
Yes.
doing that, right? So and when there are bumps along the road, how do we work on trying to make sure that we're in alignment with those kinds of things? And then the final thing is, you might hear I'm still in a sort of cold stupor. But Ruth was asking what the follow-up was with the chairs, vice chairs, and positions for the O4AD board. And I was having a hard time pulling that out of my cold infested memory with Tanya's retirement.
Sure. Okay, I'll start there and see if I can work backwards a little bit through what you described, because those were some great some highlights that I can hit on. Yes, we just had the retirement of our long-standing O4AD board member and board officer, Tanya DeHart, who has just been so incredible to work with, and really has helped move O4AD in the last year as chair in such a positive direction forward with the work that we're doing and taking on as an association. Just last month, we held our annual O4AD directors meeting and held, since Tanya was retiring, held our elections. So Irma Jimenez from Multnomah County is the new chair and will serve out the remainder of this term. Cassie Regenball from Council on Aging from Central Oregon is the chair-elect or vice chair. And then Dan Curtis from Capco in the Gorge area is our new treasurer. So that's our board officers, and we'll they'll have their first official duties at our quarterly meeting this month now, to engage with everyone. And good job, Randy. You did remember it. Good. And I think that it's a great segue to use the OPIM rollout as a way to describe our engagement with APD. So through our ongoing engagement, the AAAs really express a lot of their interests, concerns, needs to the state for what the process would be to draft or construct the waiver request that goes to the Centers for Medicaid and Medicare Services. And just as a refresher, there are provisions that say you must provide services in these ways. And if you want to do something different, that is what a demonstration waiver to the federal government is, to say we think that that's a way that we can test and do a proof of concept to deliver better services with no additional cost. And so, or OPIM, which OPIM has been around for a very long time, so Oregon Project Independence, and it's kind of been, for a lack of a better description, it's kind of been like free Medicaid services to help individuals stay in their homes, receive services with a lighter touch before going on to full Medicaid, which can avoid that additional cost. And so OPIM is the M is for Medicaid, and it would be to use state match to draw down federal funds to provide enhanced services like additional hours and cover additional services. And so that was the request to the Centers for Medicaid and Medicare Services to allow for that program to be rolled out and expanded and address wait lists for people that haven't been able to get onto OPI over the past few years because of limited. Looks like we've got a question, Marcia.
Hello. Do you have a flow chart of what O4AD is connected to in under area under 18 and people with disabilities? And
Oh, yeah, so we're not connected to aging and people with disabilities. We are a standalone nonprofit, a 501c3, and our membership is the Area Agencies on Aging. And so we are a completely independent body from this.
okay, do you have partners that you connect with? Because the original request was how O4AD works with aging and people with disabilities. So I was just trying to picture where you do touch them then, if you are.
Yeah, so you can kind of think of us like us. An example could be like AARP is an organization that's independent but advocates to the state for engagement of services and the like. And that's kind of the role that we play. So we engage regularly with them and request meetings, but we're not connected. So they would be we would be an external entity that is advocating for and coordinating with the state for programs and services. So in this OPIM example, we have our meetings like I was describing with the quarterly meetings, and we invite the state in as a speaker, and we set up additional conversations for like in the case of OPIM, we've been setting up these workshops. And so I reach out to the state staff and say, hey, this is an opportunity where we are going to be all in a shared space. We would like to talk about and then list out whatever subjects they are. So, and where it really kind of ties into the work of the Home Care Commission is that home care workers, so that having those providers available for providing OPI or OPIM services, that is a direct connection. And so we're advocating for the workforce to be there, to be supported, that there is enough individuals to meet the demand for in-home services and home care supports. And so we talk to the state about those issues and help set agendas for issues that still need to be resolved. Along the way, we've had these conversations with the state that have requested that certain things need to be addressed, like how are the payment mechanisms going to be resolved. And so we really act as a single voice for the 16 AAAs, and we consolidate information and requests for solutions.
You sure? So in your meetings, two are in person. Is there any Zoom connection that we could connect to for not for your business, but for the what I would consider instructional teaching strategies, and connect with Zoom and receive like PowerPoints on your teaching presentation.
Yeah, so we do have we've really worked to try to foster as much engagement as we can, and returning to in-person for a lot of the engagement. But for the morning plenary sessions of our in-person quarterly meetings, we do have a hybrid version of the meeting for that, so that can be connected by anyone. And then the afternoon breakout that is for the advisory councils and advocates, we continue to have that be a hybrid meeting as well. We found that throughout the pandemic, it really did increase access and participation to be able to have that virtual connection. And so that we have continued that for that one breakout. And so
I'm sorry, I was talking to my provider and didn't mute.
Oh, no worries.
Oh, just 1 second. I'm sorry.
And then I'll just finish that thought, is that for the other two meetings, they're virtual only anyway. So those are accessible.
May we have connection to that?
I will send the information for the meeting that's coming up in October. I'll send that to Jenny and we'll get that information out to the group.
That would be great. And do we have any input to what is being developed for asks for the next waiver?
For the next waiver?
You were mentioning that you send suggestions for Medicaid waiver?
Yeah, so
correctly?
Well, for this body, for the Home Care Commission, I think that would be the Home Care Commission's role to directly have that engagement with APD, to have the Home Care Commission making their connection and their requests for any sort of engagement for waiver, and I would defer to the chair for how the Home Care Commission's process.
Okay, thank you so much.
Now you heard it from the outside, what we've been saying for the last couple months. And so this has given us the impetus to get going in the next couple of weeks on getting our ducks in a row for the governor's budget.
Oh, we have to get beavers in a row also.
Yes, you want to get all of your feathered and furry friends lined up. And
okay.
you know, this is something that Nicole can speak to, I'm sure, a little bit more in depth. The process, I think this legislative session leading up to it, the governor's priorities, and the engagement that they're having between the agencies themselves and the governor's office has been a little bit different. So I will put on my other hat for a second and say, along with Mary and a few others that I recognize here, I'm also on the Governor's Commission for Senior Services, and it sounds like you've been having some conversations, as Ruth just alluded to, about what your engagement is to provide and to APD and to the governor's office. I will just say that the Governor's Commission on Senior Services has been having similar conversations about what the process is and how to be effective in that. I'll defer to Mary or else that wants to share additional. But one thing that I would say is that we had, as a commissioner, I will say that we had Justin Witham from APD provide some kind of overview of process structure and what the kind of instructions to agencies and the engagement has been this year. And I would say that that was very helpful, and he's very accessible, to the point of almost like the old schoolhouse rock. What is a bill? How does a bill get formed? They have some information in a graphic that goes through what is kind of uniquely the Oregon process of that. I would encourage or suggest that that could be a consideration for the Home Care Commission to receive that type of presentation directly as well.
When you're addressing the Home Care Commission, you also have several members that are commissioners there who, myself, I'm vice chair, and Mark, that's chair. And the duty of the Oregon Disability Commission is, excuse me, part of my breakup and hesitant speech is part of my disability. So the duty of that commission is to also we can address the governor and other things that need reinforcement to help them move to the goals. So anyway, I'll be quiet now.
Yeah, that cross-pollination is really good to force some of the messages and carry it from one mission to another.
Okay.
But some of the reason that we are wanting to get our letter and everything, excuse me, together is that the Governor's Commission shared with us what they did, and that gave us the ideas and the concept of what we thought the Home Care Commission should be doing.
Yeah, and it sounded like right when I came in, you were discussing the maybe meeting to put together your framework of the ideas of what you were going to communicate. So it sounds like you guys are really on the same pathway that the Governor's Commission was on just a few months ago.
And that's why having the interaction from the different other groups like ODC and GCSS is so important, because we can get on the same page.
Yeah, and again, the role for O4AD as a state association, that's what we do with our members to make sure that we are hearing from all 16 of our AAAs, and that we're finding what are the common issues, pain points, suggestions for solutions, and providing a consolidated, voice and consolidated messaging, so that when we share that to the state, we've done the legwork to represent what the AAA network is experiencing and what the needs for solutions are.
It's me again. Sorry. Um, if you like a picture of what we've been saying, if you coordinate the goals and the thoughts of what different groups are sending to the governor, if we send them individually, it's like having hypothetically an arrow that only reaches a shorter length. And if there are several agencies shooting a shorter arrow, it might not reach target. If you push some of the ideas together, you could develop a thicker and more forceful arrow that actually hits the target. Enough with pictures.
Indeed. Well, it looks like I'm about at time for my allotment. Was there any additional questions, or Ruth, anything else that you wanted me to make sure I hit on?
I think you've covered most everything. And then with Nicole next, we would be able to carry on with her with more questions.
Great. Well, I'll stay on for a few minutes at least to see if there's anything that comes up specific to what you're talking to Nicole about, and if there's anything additional that you want me to weigh in on.
Okay, we have not heard from Nicole though. Oh, there she is. She just popped on.
Hi, Ruth. How are you?
Hi, fine. Phil is just wrapped up. If you're ready, you wanted to go
Sure.
ahead.
What I had been sent was asking to talk about the policy option packages that the department has put forward. I'm happy to do that, or I'm happy to answer questions. What would you prefer?
Go with the policy option packet first,
All right.
because this is a new issue to some of these people.
Right. And let me be clear that the policy option packages are the wish list from the agency. They go forth to the governor. They were submitted, I think, in March or April. I have the calendar somewhere. And from there, the governor will decide what she puts in her budget. Obviously, I think, as all of you know, the governor's budget is the governor's nice idea. The legislature makes the final decisions. So the governor's budget is really seen as, an insight into her priorities, but it really is just that. And the legislature is where we fight it out. I will say that for O4AD, looking through the policy option packages, we find them very underwhelming. That is our perspective. That in no way reflects maybe what the department thinks, what other stakeholders think, just for our neck of the woods. So again, not the whole continuum or the network, just for where we stand. They are not that exciting. So there are a number of them, but not as many as usual. And Ruth, who's been through this, sometimes we have stacks of policy option packages. There aren't very many. They're pretty small. We've done a pretty thorough analysis. I'll give you a couple of fun facts. So this year, the total general fund ask for DHS is 7.5 billion. Total federal funds at 13.4 billion, other funds 1.2. It's a 10.4% increase from the current LAB, which is a legislatively approved budget, what they're operating under right now. With the total funds of 21 billion, what they're asking for. They are asking for 11,487 positions, or 11,388 FTE. A couple of policy option packages that we are kind of interested in. And again, know that these are ones put forward by the department, not by O4AD. Policy option package 560 has to do with the MED, which is the medical exclusion right now for people with disabilities who are trying to receive behavioral health services. This would allow APD to overcome that, which currently flies against what would be considered civil rights statute. APD is also, though, stuffed in there some pieces around recruiting behavioral health specialists, some pieces around adult foster homes, and a number of positions. It does create a higher cost per case. It does not address the issues that O4AD have been working on, certainly with people with disabilities, but we've also been talking about older adults who have a difficulty maintaining their behavioral health services as they transition into long-term services and supports out of just straight care under the health plan. Does not address that. So we find that to be a problem. Something that people have heard a lot about is the current regulatory issues in facilities. Policy Option Package 101 looks at safety and regulatory oversight. What this does would allow ODHS to have a different level of oversight, but only over newly licensed or facilities who are relicensing, or like a change in ownership. Only those residential facilities, AFH, DD facilities, that's all. And, I think I know why they're doing that, because it's very difficult to sort of go back to the ones that are currently operating and do that. I have a feeling, this is just my gut feeling, it's probably not going to feel very satisfactory to advocates and consumers who are dealing with the current regulatory issues right now in the facilities, but this is what they have proposed. Again, it will only affect newly licensed facilities or those that have a change in ownership. They've asked for some resources around the access rule that Phil was mentioning. But it's the policy option package primarily focuses on developmental disabilities division. We aren't really seeing a lot of correlation to aging and people with disabilities. One that they've talked a lot about to us, policy option package 114. This one, so for those of you who are following this during the session, there was a big conversation around waiver case management. We have a number of individuals who are eligible for Medicaid services, but are not able to actually secure the direct services at this time. We are, via Medicaid regulatory rules, required to continue contact with those individuals and continue to work with them. We had not been funded in Medicaid for that service. The Medicaid area agencies were able to receive our funding for those positions. The department did not. This policy option package 114 includes the funding for APD. The part of it that causes me some heartburn is there is a lot of conversation in here about blah, blah, blah. They want to talk about some other pieces in, looking at different ideas in case management. They want to look at, kind of a lot of different pieces of it. Let me read exactly what it is. Support, increase requirements, ensure compliance with regulation. They want to talk about some, new ideas in person-centered planning. All of those are good things, but there's no funding in the policy option package for anything that I can see. And if I'm incorrect, certainly I will let you know. But as I read it, there's no funding for anything except the positions for aging and people with disabilities, the state staff and waivered case management. So I feel like there's a lot of things in here they're asking for, but they aren't asking for the funding behind it. And that always is something that causes us concern, because then we become burdened with unfunded mandates. And as Randy mentioned, our Medicaid area agencies are approximately 60% of the caseload. We are serving those people. And so when the state comes up with an idea in Medicaid, we want to make sure that it's actually adequately funded, because we're going to be the ones who are doing the work. So that one causes us some problems. We're not sure about that one. Policy option package 110 asks for
Nicole,
funding. Oh, yeah.
Can you slow down just a little bit? You're getting, the interpreters are having a hard time keeping up.
Oh, sure. Sorry about that. Policy option package 110 asks for funding to the department to backfill positions that they have already chosen to put in place with other funds. The interesting thing is when you read through the policy option package, what they're not doing is saying if they don't get funding, they will remove those positions. That's not stated in here. And I think there's a question about that, and something that the department has had a lot of criticism for is, if you can find the funds, why come back later and ask for it, particularly in this case where they're not saying that we're going to have to let go of these positions. So very interesting piece there. Those are primarily the major ones that we see that have some impact to our service area. We are in constant conversation with legislators, leadership, with the governor's office around what we think about this, how we, feel about it. Ultimately, final recommendations from the agencies around their bills, around the policy option packages have to be into the governor by the beginning of November. The governor's budget is due the first week of December. It will be released. But again, as we talked about in the beginning, the governor's budget it's her idea of what she feels should be a priority and how that should happen. But the legislature ultimately makes that decision. And so it's a good insight, but the real discussion happens in January when we come back into the building. I'm happy to answer questions on the policy option packages if there are any.
Yes, this is Paul Johnson.
Mm-hmm.
I'm curious, when you talked about unfunded mandates in the APD policy option package here, where you were referencing that. That makes perfect sense what you were saying. What concerns me is that those who were with APD or helping with that, are they receiving any feedback so that they understand that because they're requesting things or stating things in the POP that are not funded, that it won't see the light of day, or it won't be necessarily realized because there's no funding source or funding requested. It's one thing to request it, but if forgive me if this is incorrect, I don't mean it to be harsh, but if it's not properly done or incorrect, then we need those who are writing the POP to be aware of that, at least from your perspective, from those who are processing these things forward, so that in the future we can include the financial part if needed.
Right. I can't speak for how or why the department puts together, how they put this together, but certainly O4AD, that's my job, is to put forward from us to the appropriate people and, appropriate policymakers what we think about it. And we do that. And, that's the process that I'm in right now, is having those conversations and saying, look, it might be a nice idea, but there's no funding. We as O4AD will not be able to support that. Again, we don't really have a statement on the positions with waivered case management. We leaned in pretty hard on that in 24. We gained our positions. We understand that it's a Medicaid mandate. So like that piece, that is an issue for the department to fight that one out with legislative fiscal. It's all these other pieces that are stuffed into it. That's where we have a problem. So we will communicate that. How that shakes down into the governor's budget is something that we will all find out in December together.
Thank you.
Of course.
Hi, this is Commissioner Adams. A question that's been bothering me and I'm trying to get a grasp onto it. If the ODDS and the APD is trying to get money for people with mental disabilities and stuff, then there's funding from OHA going down to the CCOs. What's the big difference between the two?
A great question. And it's one we've worked really hard. We passed a budget note a couple years ago. So the issue comes, and it's a lack of coordination issue. So you are correct. Behavioral health services fall under the Oregon Health Authority. That's where they live. They are not a service provided by the Department of Human Services. When an individual who perhaps has been in the health plan getting their care under a CCO, but they age into long-term services and supports so that, activities of daily living type of care moves then into DHS, we've seen people lose that service. And, we did a budget note that both agencies reported on it, and they were very honest. And I really respect that. They said, look, we just couldn't figure out how to do it, so we just didn't do it. It's not an adequate answer. It's not an acceptable answer, but it's an honest answer. And I get that. So it's been a problem with the two agencies not being able to kind of figure out, what do we do? As we have argued really loudly, the behavioral health services are an entitled service. You don't just lose them because you just moved something, you know, because your long-term services and supports moved. You don't just drop that. We have to figure this out. I would say with the MED, which is a medical exclusion, is an attempt at that. I don't, you know, I think it's important, but I think what, you know, my issue is the, it's not a very holistic. I'm not seeing anything in here for older adults who are having the same issue, but it is looking at that piece of it. I also think that they are putting a lot of other pieces into this that price it in a way that may not make it as palatable versus dealing with the MED. But, you know, we'll see. That's a question that I need to talk to the department with and see what they're really thinking behind it and how they rationalize it. But that's the issue at hand. It's more of a coordination and like a lack of system, I guess. And it shouldn't be like that. It shouldn't be like that for people with disabilities. It shouldn't be like that for older adults, but it just has been, and it's something that we need to address. That's why we passed the budget note. There's a report that came out from DHS and OHA about that, you know, was pretty honest, talked through the issue. What, you know, we continue to push for, though, is to see the change that actually causes the issues to be addressed.
And I have one question that's not related to that, but when the DSACs all get together for the 4OD, for the 04AD, get together in Salem, why is it not recognized that we as consumers that are on these DSACs, because I'm one down here for the 2 county, realizing that we can't afford to come up to that meeting and that the 04AD can give us the money to do that instead of it coming out of our own pockets.
Well, traditionally, and you would need to check with Joseph, DHS should cover those expenses for you. They have in the past. It's been something that's been reimbursed or they've covered it. I don't know if that fell off during, but it shouldn't. So I would suggest that you question Joseph about that because it's always been covered previously, and they've covered the travel and the accommodation for people to come to O4AD's meeting. The responsibility for that is with the department because the DSACs outside of the Medicaid area agency ones are housed within the Department of Human Services. So it is their responsibility to make that accessible for you. I would ask Joseph that question. Ruth, you know, is familiar with this. But if you are in a DSAC, a Disability Advisory Council that's housed within DHS, which would be any of them outside of the Medicaid area agencies, in the past, they've covered it. And that may have just fallen off, but I would ask the question because that's always been the case.
All right, thank you.
Of course.
This is Marsha Wetzel,
Mm-hmm.
and I took your boot camp
Yeah.
years ago, and I'm wondering if some of the parts of the boot have changed, and I might need a revised copy of it.
So boot camp, we're going to bring back, we're going to try to in January, depending on timing. If you want to register for that, again, if you're in a council that's outside of the Medicaid area agencies, that should be, ask Joseph, that should be reimbursed by DHS, but ask them, they may have changed their policy. When we're ready to announce what we're doing for advocacy training, we will make sure that this group has that as well as others. Right now, O4AD is the only group that provides advocacy training for older adults and people with disability issues specifically. And so we are delighted to bring that back. Phil will be delighted to help me schedule that. See how I said that? And we will look forward to making sure that everybody has the information to sign up for that because it does change. It changes a lot.
Okay, will it be available in Zoom or something?
I'm not sure yet. I don't know that. It will kind of depend on cost and location and timing.
Yeah, because I'm I can't I'm confined to home, and I can't get out to go
Mhm.
to it. Although I'm an Oregon Home Care Commissioner and a vice chair and ODC
Mhm.
vice chair, uh, I need to know a lot of that information.
Well,
And
and I'll tell you, there's a lot
as
to know for sure.
yeah, I need an update, but I can't get to it
Well,
theoretically.
that I totally appreciate that. And those of you who've known me for a while, I'm a firm believer that, those of us who have the ability to advocate, we advocate for the people who can show up and the people who cannot, and we bring that voice to this work. I think one of the good things, quote unquote, that came out of COVID is that we've, all become more comfortable with remote communication. Certainly in the Capitol we have. Before COVID, it was just impossible. It was impossible to even schedule a Zoom with a legislator. Now it's very normal, and I think it makes things more accessible. Phil and I will work on scheduling that, and it kind of, unfortunately, it kind of does depend on where we can land the plane as far as where we do it, if they have that capacity, but we'll definitely keep that as a consideration.
Thank you. Now,
Right.
speaking of um, Zoom meetings, uh, I read rather, so this is secondhand information, um, that the uh, the current federal administration was going to, uh, as an attempt to lower Medicare costs, was no longer going to pay for virtual health visits, which has a dire effect on me because I can't go out for all the appointments I would need. It would be um, physically totally cumbersome. Do you know if this was just a floating around nothing or it's actually landed?
With Medicare, it's federal policy. Those types of issues around virtual visits come up a lot. Um, I think it comes up as often as it doesn't come up. So those are all big federal policy issues. We're in an election year, so nothing is going to change here in the near future. In the event that that was a real threat, I think we would certainly know about it. I think you would hear about it from a large variety of groups, but right now there isn't a valid proposal that has any ability to move right now.
Okay. Uh, I had so many thoughts come through when you were reading all that, but my brain didn't keep them all. Regarding behavioral care, um, I again, this is secondhand information, but from real people that are in my world, um, they have changed behavioral health, at least in Marion County, where counselors, uh, they recognize Marion County Board of Mental Health as a source of counselors. And they have switched to every other week for a counseling appointment because of shortage of uh, counselors. And they have a shortage of case managers. My real people in my life are like up in Woodburn, and they can't easily access that at all. And their pharmacy care, there's a shortage of pharmacists. So people that have to receive their meds in a pill package and their prescription changes, they get flashback from the pharmacist about we can't do this. So uh, there's a shortage everywhere, but I see it play out in the actual, this is my personal observation, of my secondhand real living people, uh, their stability has changed a little to uh, a lower ability to deal with their life. I'm concerned. This has just happened sort of recently, but if it keeps going for them, um, I believe that they are on a slippery slope of slow decline, which would deepen their need for care. Uh, Anybody realize that?
Oh, I think so. It's a huge conversation around behavioral health. The lack of providers, lack of people interested in accepting Medicaid as a payment in providers. It's a huge issue and not one that unfortunately has an easy fix. You know, I mean, there's just such an escalated need for behavioral health and a decline in the number of people, A, that just provide behavioral health services, and then B, the number of people who are willing to accept Medicaid as a payment source for that. It's a big issue. Everyone's talking about it, but unfortunately, there just aren't easy answers. You know, we can't force people to go into behavioral health as a profession. We can't force people to stay. And if an individual as a provider decides that Medicaid is not the right payment option for them as a provider, you know, that it's a very tricky issue, very difficult. And you are speaking to the everyday problems that are seen by so many across the entire continuum, you know, children, you know, teenagers, young adults, adults, older adults. It's all the way around, and it's a huge challenge and something that, you know, the conversation continues. People are trying to figure out solutions, but it's a difficult one, and it's unfortunate because, like you said, it impacts people on a day-to-day basis, but it's something that they're continuing to look at, continuing to work through. We continue to remind people to consider older adults and people with disabilities in the conversation. There tends to be a lot of focus on children and teenagers. I have a child, so I understand why people are looking at that, but we have to look across the entire continuum. But it's something that people
Amen.
are very aware of. But, it took a long time to get to this issue, and it will take a while to get out of it.
Has anyone thought of providing the tuition
Yes, there are programs that do that right now.
for training in behavioral health?
Those do exist.
I would like to know the source. I believe I would be a good evangelist.
I'm sure that your staff would be able to pull that up. There are a few programs that do that right now within the health authority that provide reimbursement for or tuition programs in behavioral health.
Wow, thank you. I'm sure tonight when I go to sleep, I remember what I forgot to ask. Okay, thank you for speaking with me. This is
You're
great.
welcome.
We need to move on. So George
Yes,
has a question for
I'm
you.
done.
George.
Ms. Chair, I was wondering if this would be in our realm for us commissioners to help them with Phil and the other lady on what they're doing for mental health to get the ODDS, APD, and OHA together to help put this together where it's not going to be divided in between them.
Well, let me be clear how the Home Care Commission operates and ODDS and those, you all operate differently as a part of the state than O4AD. So we are not necessarily taking the lead in this conversation. We're supportive of it, but we're working on other issues. We'll continue to be supportive of it and engage as we can. But you would want to work through your processes and the state process because you are group, an entity, a commission, underneath the state. So you kind of have a different process you have to work through than O4AD does. But that conversation continues. And as Phil pointed out, Justin Witham is a great resource for that within APD. He's their legislative liaison, so he would be a good person to talk to and to understand how and where the commission might be able to impact that conversation.
Okay.
Thank you, Nicole.
Thank
And
you, Ruth, for the invitation.
well, and we really want to be able to keep abreast of what each of the other agencies are doing. So if there is some place that we can fit in, that we would be ready.
Absolutely. And I think that, we're all stakeholders. So, we work with stakeholders versus, the agencies that are working amongst each other. We're all having big conversations. We're meeting, like I said, with leadership, with the legislature, with the governor's office on nonstop. I think, however, is appropriate for the commission to lean in with your perspective, do it often, do it early, because things will move, things are moving fast.
Right.
We're 33 days from the election, and once that election's over, for me, we hit the ground running, and we're moving right up until the day we go back into the Capitol.
Thank you.
Thank you very much.
Nicole,
We need, George, we need to move on the agenda.
okay.
Okay, it is time for your break. That's the reason I keep pushing to get this going. It's time for a 15-minute break. So we'll stop the recording for the next 15 minutes.
Ruth, the recording does not stop. The
Okay.
recording keeps on going because otherwise I end up with 2 Zoom meetings.
Oh, okay.
Yeah, so we just leave it running during break. But
Okay, then.
Joseph Lowe is planning on being here at 12:15.
Yes.
Okay, thank you. Hi, Joseph. Joseph, can you hear me?
I can.
Okay, super. Thank you. We're just getting back from break, so.
All right, that works.
And I do have your document here. So let me put that up. I did send this out to the commissioners too, so they
Okay.
should have a copy of that.
All right. Does that mean you're ready for me now?
Well, I think our commissioners are still gone.
Okay.
I don't even see Ruth back yet, so let's hold on for a minute.
That's fine.
Thank you.
I'm back.
This is Randy, me too.
Super, thank you. We don't have Ruth back yet, or Paul, so.
You have Marcia?
Yep.
Yep.
I'm back.
Okay,
Okay.
good, Mark.
Super. Well, Joseph, it's 12:15. I guess if you want to get started.
Yeah, if y'all want me, or I can wait a minute to give Ruth a chance. Either way.
Okay. Yeah, thank you.
Is Joseph ready?
I am. How are you?
Okay.
All right. I will dive on in here. So as you know, the DSEC quarterly meetings, we've started holding those on the fourth Tuesday. I need to reword that a little bit. It says of every month. We don't do them every month. And so, wow, I definitely need to update that piece. I totally missed that. Sorry about that, Heidi. Our next one is going to be October 22nd, which it does say down at the bottom. We had skipped the June one due to, I believe that was the APD Community Partners meeting at that time. I'm not sure. But at the time I typed this up for Heidi, I was still working on our agenda. I've almost got that complete. Right now, what I'm thinking is Beth Jackson wanted to come and give another update on the 1915C waiver work that she's doing. We're going to have Jason Pruitt to come and give an update on agency with choice. And then Max is going to come and talk about the agency recommended budget and the upcoming legislative session. I'm also going to try to reach out to the Disability Health Employment and Employment Equity Coalition. That's what I was trying to say. And let them discuss the work they are doing around submitting legislation to make changes to our Employee People with Disabilities program. That's the goal for the October quarterly. Hope those of you that are DSAC members can make it. And if you're not a DSAC member but want to attend and check us out, let me know and I can get you the meeting invite. The status updates for each DSAC, I just kind of listed those for you. Districts 1, 3, 2, 4, 5, and 8 are moving along just fine that I know of. Nobody's contacted me with any questions or any issues to work on. Districts 6 and 10, the district managers last check-in was still busy holding meetings with staff, partnering organizations, etc., trying to gain some recruitment momentum. And they said that there's not been much progress yet. District 7, which is the Coos and Curry County area, has their DSAC. They are very new. They have, I think it was 4 members the last meeting I attended with them, and they are working on recruitment still. The districts 9, 11, and 12 was contacted by APD's Director of Branch Operations, Christy Shipman, as a nudge to get them moving in their recruitment. We got the pushback from them that they would like to still wait because they need to hire the admin support to be able to staff the council and things like that. So we are on the waiting game and seeing what happens there. District 13/14, which is pretty much Eastern Oregon, put their council on hold for a while due to the district manager reported overwhelming workload from all of the new APD program rollouts. District 15 is continuing to rebuild from scratch. They have 3 members now and still pushing their recruitment. And they've asked me to continue attending their meetings to help get them moving again. District 16 is up to 3 members now, and they have been approached by 3 interested parties. So they're hoping to get 3 more very soon. The Employee People with Disabilities marketing style campaign that I've mentioned here before, it's to help bring information and awareness of the program to consumers and to our case managers. That is still stalled out. It's not went anywhere since then. However, like I said, the Disability Health and Employment Equity Coalition has started meeting. I included their website and their email for those of you that may be interested in learning more and potentially get involved with that. And what else did I have? Oh my goodness, my screen changed on me. And then there's no updates that I know of around DME efforts through the Oregon Health Authority on Buds team. ODC did host in partnership with the RO and Northwest ADA Center their yearly ADA celebration. I'm sure either Mark or Marcia has given you the details on that, so I won't speak too much on it. Just wanted to share that our average this year per week was 165 attendees, which was down a little bit from the 250 per week the previous year. So I'm going to personally be looking into that and trying to figure out what happened. Was it something we did differently with advertisement, or what caused that decrease And if it's something that we can control, we'll work on that to try to get those numbers up again next year. Then I just listed all my continued efforts with the other things that I do, the Disability Emergency Management Advisory Council, our employee resource group known as AbleNet. Probably can take that one off the incident response team since I work remotely. I don't think that's going on. Most of us are remotely now, so I don't think that's even going on right now. APD. What was that? APD Service Equity Advisory Council. Also Oregon's Office on Disability and Health Advisory Council. Public Transportation Advisory Council, and other duties as needed from my team. And then also to just let you know, as my role on the Public Transportation Advisory Council and being the transportation subject matter expert for my team, I will be attending the Public Transportation Conference in Seaside this year from Sunday, October 27th through Wednesday, October 30th. Any questions?
It would help for me, especially, that when you put out a list of the different area agencies but you just put the numbers, you don't put where they're located. Or could you put some kind of a ledger with this saying what each number is and what's the name of the area agency on aging?
Yeah, I can go. What I'll do is at the bottom of this list, I will add what counties are represented by each district.
It would help so we could better orient ourselves as to what's active in what's part of the state.
Okay, yeah, definitely. I will add that to the bottom. I'll actually add it to the bottom of this and resend it to Heidi, and that way you can get that right away instead of waiting until next time I'm here.
Okay.
Thank you, Joseph.
Yeah, no problem.
Any questions for Joseph?
Joseph, this is Commissioner Adams. With the 04 AD get together at up in Salem, why can't the state pay for our way up there instead of us taking it out of our own pocket and being reimbursed?
So if you're attending the quarterly on behalf of your DSAC, your budget should be paying for the travel reimbursements. Now, it may have to come out of your pocket first, unfortunately, and then file for the travel reimbursement claims. But your DSAC budgets should definitely be covering your travel to the 0480 quarterly.
Yeah, but some of us consumers can't afford it coming out of our own pockets.
I would say to chat with, I know Sharon is your staff support. I would chat with Sharon and your district manager and see if they are aware of any process to do advancements. If they are, they could do it that way. If not, then have them to contact me and I can run it up the chain through my manager and see if we can get approved for advancement.
Next question I want to ask you is, can the DSACs, well, the one existing here in the 2 county, is there any way that our budget can go a little more in its financing instead of just where it's at now? So we can,
Like an ink or
so we can spend things on it instead of having to, like we're only spend up to a certain dollar amount. Is there any way to expand that?
yeah, so you're asking for like a budget increase per biennium?
Yes.
You can always put that proposal together and submit it to me, and I can share it with APD leadership and see if they are willing to do that. I know that it definitely has been the same amount since the budget policy was created for the DSAC. So there most likely is going to be room for argument to increase that budget. So yeah, if you can put, if your DSAC can get together and put like a little proposal together, submit that to me and I will take it to leadership and try to get it approved for you.
Because I'm the vice chair on that 2 county down here. And we are really doing a lot down here.
Yeah, I agree. Your DSAC is one of the mover and shakers that we have right now. So yeah, if like I said, if you can get your council to write up something making that request, send it to whether it's the DSAC inbox or my email directly, I will pass it on to APD leadership and see what we can get done.
All right, thanks.
Yeah. All right. Any other questions or comments? All right. Well, I will make that addition to this and get it over to Heidi so that y'all can have the layout of those districts. And I will catch y'all next time.
Thank you, Joseph.
Thank you.
Yeah, thank you.
Joseph, can you send me an email on the October 22nd so I can have it?
Yeah, the agenda for that has not been sent out to everybody yet, so they don't have a calendar invite yet. But soon as I get the agenda finalized, it will be emailed to the DSAC network.
I need to get it on my schedule so I don't have anything else go on it. That's what I'm asking.
Yeah, it should. I have one other thing that I need to do with the agenda, so I'm hoping to be able to send it out by tomorrow. If not, it should come out early next week.
Thanks.
Uh-huh.
Okay, thank you, Joseph. And now, Kelly, are you ready? Are you with us?
I am.
Okay.
Sarah McEwen and everybody else. I hope everybody's doing well. And Heidi, thank you, Heidi, for putting up my report for me. Okay,
Can we see who you are?
Oh, sure. Let me turn on my camera.
Thank you.
Hi, everybody. Okay, so thank you, Heidi, for putting my report up for me. This is the time of year that I present an annual report, which captures the last fiscal year as well as policy year with SAFE, which ran from July 1st, 2023 through June 30th, 2024. And the claims we'll be focusing on are in the 2024 column of the report. And so I'll hit a few highlights and talk about a few of the claims. And then if there's any questions, of course, ask me. Or if you want to follow up with any additional information later, you can always reach me at the Home Care Commission. Okay, so there were 102 claims filed this last policy year. And as you can see, that number is significantly down. So a lot less claims are being filed by both not only home care workers, but personal support workers. And when I talk to SAFE about this, and this is a trend right now for workers, they're filing less claims for multiple reasons. And one being that filing a workers' compensation claim is a personal choice. You do not have to file a claim when you're injured. You can go through your private insurance. And some people are choosing to do that from what I've asked a few of the workers that are choosing not to file claims. And they say it's just easier. They're not going to have any time loss and they don't have to go through all the paperwork with the workers' compensation system. a lot of our workers have filed previous claims. And you'll see that on the report. Actually, it's 29% of all the claims that have been filed. These individuals have filed previous claims. So we have a lot of workers that have been doing this work for a long time. Injuries have happened, and they just prefer to go through their regular insurance. So I think that's happening a lot. There's also people are going to our safety classes and learning some safety tips that are targeted towards their profession as a caregiver. And so maybe the claims are down because of what they're learning in our classes. We'd surely like to hope so. So anyway, so that's the number of claims per year. And I'm going to just skip down. I don't need to go through each one of these items because everything's pretty consistent year after year. So going down to the average age of the injured workers, although this is consistent, it's 58 years old. The youngest home care worker was 24 years old that filed the claim this past policy year, and the oldest one was 85 years old. The 85-year-old home care worker was assisting her employer with ambulation. Her employer began to fall, and the home care worker sustained a knee injury while kind of holding her up and keeping her from falling. Her knee like buckled, and then she sustained an injury. Luckily, it wasn't a bad injury, but unfortunately, she was injured that day while at work. And then the youngest was a 24-year-old. She claimed that her employer had assaulted her with investigation. That claim was denied, and it was not a work event that had happened. So that claim quickly closed. And then skipping down, we'll go down to the average time lost days. This is 80. That means from the disabling claims, there was a lot of severe claims that happened, and there was a lot of time lost days that hit our policy. So the average number of time lost days for all the disabling claims came to 80, which is very high. And then let's see, what else will we look at? The claim types. The claim types is where it says non-disabling claims, and there's two categories. When I pull reports year after year, I pull these data reports from SAFE. And when I pull up the claim types, it tells me if our claims are a non-disabling claim. That means the injured worker goes right back to work, or it's a disabling claim. And that means the injured worker is off for over 3 days, and they're going to receive time loss benefits paid out for their work injury. Well, this year we had an unfortunate new category to me, and it was fatality. So we did have a claim that resulted in a fatality, and I'll tell you a little bit about it. How it came in our office was that a 58-year-old male home care worker, we got a call from his employer. She reported that while lifting her scooter and putting it in the car while grocery shopping, he had dropped it on his foot. And she said he didn't seek treatment for over a month. And when he did seek treatment, they put him in the hospital, and he ended up having to have his foot amputated. And so, although we couldn't talk to him because he was hospitalized, she gave us enough information that we could file the claim with SAFE. So we filed it with SAFE, and I contacted OSHA because for a claim like that, if you're immediately hospitalized, I have to contact OSHA, but especially also if there's an amputation. So I notified OSHA of the injury, and everything was given to SAFE to manage the claim. SAFE later notified me and Tricia that the individual had passed away due to complications. And later, a month or two later, after an investigation where SAFE collected all the medical reports, hospital reports, medical history files on this injured worker, and they denied the claim. And they denied because all the medical reports, the hospital reports, everything led back to he had been treating for 8 years for a condition which led to his death. His family appealed the denial, And there was a hearing set, and it was actually scheduled for next Thursday. And then I was just notified a week or two ago that the family decided to withdraw the hearing. So the claim is now closed. And so that was unfortunate, very sad story. But I just wanted to let you know there's now another category on our policies. And we hope we don't see this one ever again. But that's what happened to this provider. Now I feel all like it's all depressing. I'm so sorry. Sometimes workers' comp is not so fun. Moving on to let's go to the next page, Heidi. Okay, so this report, this annual report provides the claim frequencies and the claim severities. The first boxes on the left are the claim frequency. So these are the claims that it's the most common claims. So in 2024, the most common cause of injury was falls, slips, and trips. And the second was lifting. This is unusual. Normally, number one is lifting for home care workers. That's usually the number one cause of injury. But this year, there were more falls than lifting injuries. And then you'll see the most common injured body parts are backs, shoulders, and knees. Those are pretty consistent year after year as well. And then looking on the right side of the report, this is by claim severity. The most severe claims are listed here, and how they happened and what body part was injured. And these are driven, these numbers are driven by the claim cost. That's how we measure the severity of a claim. So you'll see that the most severe injury causes for the past 3 years in a row, almost 4 years in a row, has been falls, slips, and trips. And the reason for that is usually when somebody falls, it's an impact. And a lot of times more than one body part is being claimed at the time of injury and being treated. Rather than, let's say, if you strain your back lifting something, then it's a strain. And most often a strain will heal quicker and be less costly than a break or a fracture of a bone. And then the most common injured body parts, the most severely highest cost body parts were hips, knees, and brain injuries. Those are concussions. And there were a few of those this past year. Okay, so that is the home care worker report. And now we will move on to the personal support workers.
Kelly, this is Marcia.
Marcia?
Yes, hi. You were talking about what's covered by SAFE in your contract and about regarding the death. And it was determined that the person had a previous injury or condition. Is that true of just fatalities or any injury reported?
Every injury. If there is a history of prior treatment, then they look at was work the major contributing cause for the need to seek medical treatment. If it was, then the claim will be accepted. If not, and the doctors are saying work had nothing to do with it, this happened long before, and what happened on that day at work had nothing to do with the need for treatment. This would a continued treatment anyway. And if the work injury did not worsen it, then the claim would be denied and they would use their private health insurance.
But if it worsened it,
it would be accepted, and then we would pay on that claim and the medical treatment until the injured worker is restored to pre-injury health. So right before. So even if they had a bad knee prior, if it worsened and there was an aggravation, once that knee is back to how it was the day before the injury, then the claim stops, and then that injured worker continues to treat under their private insurance. So we'll pay on that claim for a while.
Yeah. are they required to disclose fully their past?
To SAFE, yes, and if they don't, SAFE finds out anyway.
Okay,
Often, sometimes SAFE finds out, oh yeah, we have other claims on the same body part from another secondary employer. So they have already filed claims on that same body part. That happens once in a while. Because SAFE is such a major workers' comp insurance carrier throughout the state of Oregon. So they cover a lot of different employers, not just the state.
thank you so much.
Great questions, Marcia. Thank you. Okay, personal support workers. We see that 25 personal support workers claims were filed. And personal support workers, this is the name of the policy. It's the personal support worker policy. And then we have the home care worker policy. Under the personal support worker policy, we have personal support workers, we have personal care attendants, and also the ICP providers, independent choices program providers are covered under this policy. So of those 25 claims, 19 were personal support workers, 2 were personal care attendants, and 4 were ICP providers that sustained injuries. And again, everything's pretty common with this past policy year. Nothing really stood out. So going down the report quickly, although the average age, they did hit over 50 now. So they're aging right alongside of me. Well, no, I wish I was 50. But they're aging, and now the average age is over 50 for this provider group. And the number of claims accepted were 76% of the 25 were accepted claims and not denied. 48% were non-disabling. That means 48% of them came right back to work after the injury with no missed time loss. The average number of time loss days for personal support workers was 61. And those are for the most severe claims where the individuals were off work for a long time. We took an average of that and it was 61 days. If you look at the very bottom number, 96% of the injured workers returned to work for their consumer employer. This is a great number. That means those injured workers, their job was maybe temporary filled for them, or they came right back to work and they went back to work for that same employer that they were injured, where they were injured at that workplace. That's great because sometimes the workers are injured and they need to be replaced by a different provider or an agency, or somebody comes in and for whatever reason that injured worker, maybe it's their injury was too severe, or the consumer employer decided to stay with their new provider that they have in place, or maybe a family member took over their care. But sometimes they don't come back to work and they have to find new employment and a new consumer employer, or move on. Some of them don't come back to home care work at all. But anyway, we like to see this number really, really high, and 96% made me happy when I saw this. Okay, next please.
Kelly, I had a quick question. And I'm not sure if you have insight into this or not, but under the health insured, where does that number come from and the fluctuation in that number from year to year?
From year to year. Okay, so each claim that we file, we complete a checklist and we contact the injured worker and collect data or injury information and treatment information. And we contact also the case manager and the consumer employer, and we complete this report and submit it to SAFE. This is one of the questions on that report, on if they have any other coverage besides their workers' compensation coverage. So it's captured there. It's also data that we need to include on the 801 form that we submit to SAFE, which is a state workers' compensation form. So that is the information we collected from the injured worker on whether they had other coverage or not.
Do you happen to know, like, I'm sorry, I'm really making you stretch here. Like why they didn't have insurance? Was it maybe they weren't working enough hours to qualify for assistance? Do they ever tell you?
No. I mean, if they share that information, we would note it, but they don't normally share too much. It's basically a yes, no question.
Okay, thank you.
But we do know we do collect who's the insurance carrier. And we capture this because this is really important. If their claim's denied, it's really nice to lead them back to their Aetna insurance or their Prudential insurance, Blue Cross Blue Shield, and remind them that they have that other coverage to fall back on. So that's a good thing. We want this number high. It's been high consistently for a long time. It used to be prior to 2015, it used to be even lower. And so that's good. If the claim is denied, that they have other ways to pay those medical expenses.
Kelly, this is Commissioner Adams.
Hello.
With these numbers and percentages, if it's too high, will the providers have to retake the class to bring the percentages down?
We don't, our classes are not mandatory. Are you talking about our safety training classes?
Yes.
They are not mandatory, but with each claim that is filed, we send an 801 form to the injured worker with a cover letter on how to complete the form. And then also letting them know, hey, your safety is important to us. These are the classes we offer. We recommend them, and this is how you register for a class. So we encourage them to take our classes, but we cannot make them take our classes.
Okay.
Okay, have the next page.
Kelly?
Yes.
Yeah, I had my hand up.
So sorry.
It's all right. Is it a true statement that when you have an injured worker and you have to have someone come in while they're doing their workman's comp thing and do their job while they are missing in action? And then when they return, no matter how long it is, you have to take them back at the same number of hours?
No. We hope that all our injured workers are able to return to work for we call them the employer injury in the workers' comp world, but for their consumer employers. But sometimes workers come back with limitations. The sooner they can come back, even doing light duty work or modified work, the better. The quicker they will heal because they're back in the workplace, they're moving their body, and studies just show that it's better for them, it's better for their claim, and it's better for their consumer employer to have their regular worker back. But if there are some tasks that they are not able to do because of their work injury and somebody else is doing it, then chances are they will need to do less hours, and then maybe somebody else is going to have to, their hours would be increased to take up that workload. Under some circumstances, if it is because of their work injury and they're not back to pre-injury health yet, then if they have a reduction in hours, their time loss benefits will pick up that portion that they're missing by having a reduced number of hours.
Thank you.
Great questions today. Thank you. Okay, so here
Called
is
lived experience.
Did I miss another hand?
Oh, can I take it away?
So here is the personal support worker claim frequency and claim severity page. They also had number one is falls, slips, and trips being the claim frequency and also claim severity causes of injury. And then you'll see also that for their most expensive and severe body parts, they had wrists, elbows, and backs. And that was a really severe wrist injury that we're looking at, that the average cost, I think there was only 3 wrist injuries. So the 3 of them averaged to $44,060. And so one of them was really bad and required multiple surgeries. So that's this report. And if there aren't any other questions, then.
You have a question,
Oh. Hi, Paul.
Paul?
Yeah, hi, Kelly. Thank you for the good report. I wondered if maybe this isn't a good question, but have we ever maybe looked at the major injuries that reoccur and look at our training to see, okay, to see if any modifications can be made to the training we're offering that might address these major injury categories?
Absolutely. For a while, we were seeing a lot of needle pokes. And so how were they happening? The injured workers were recapping needles. So it was like, that was immediately putting in our preventing disease transmission training. Never recap needles, put them straight into the sharps containers. And so frequently we do look at the injury causes and make sure that they're covered in our classes. Because of motor vehicle accidents that were happening, and some of them were really expensive and severe injury claims. We came up with a driver safety class. So yes, the curriculum is looked at and reviewed to make sure that the most common causes of injuries or things that are happening in our consumer employers' homes, we want to make sure if it's repeatedly happening that it's addressed and it's out there, and we're training a different way or better way to do it to reduce the injury.
Thank you.
Any other questions?
I don't see any more. Thank you
Thank
for
you.
your good report.
Well, thank you so much. Good to see you all.
Okay, we are at the point of adjournment.
Ruth, I have a request.
Yes,
Since we have all the commissioners together right now, could we work on or decide upon a time next week to meet with Jenny about the letter? I found some time on her calendar when she's available.
okay.
Okay.
But first of all, I want to check in with Patty and see if I think
she
we
just
lost
left
her.
the meeting.
Yeah. Okay. Then go ahead, Heidi.
Okay. We have Wednesday, October 9th from 2:30 to 4. And you said that you wanted 90 minutes for this?
Probably, yes.
So Wednesday, October 9th, 2:30 to 4. Or we have Thursday, October 10th, either from 9 a.m. to 10:30 or 10:30 to 12.
Let me check my schedule.
I can't do the 10th, but what did you say on the 9th?
The 9th is 2:30 to 4.
I can't do the 9th either way.
Well, we probably won't have a date when we can get everybody, but on the 10th we have 9 to 10:30. I'm putting these in the chat, or 10:30 to 12 o'clock. There you go.
Looks like I also have Friday, the 11th in the afternoon.
Let me look, Jenny. I was just looking for an earlier time. I'm opening my Outlook here.
I have 1 to 4:30.
1 to
1:30 to 4:30.
1:30 to 4:30 on the 11th.
Anytime in between there.
So those are the options.
I could do Wednesday the 9th or the 11th in the afternoon.
Who would be available on the 11th?
I would be
Paul's not
available.
available.
I'm open on the 11th.
I am not.
You're not, Commissioner King? Okay.
I'm open Wednesday.
Yeah, I don't know if we can find a date or time when that's gonna work for everybody, but
Do you want to have two separate meetings so those who can attend the first time and then with the next meeting share everything? So if somebody can meet on Wednesday but they can't on Friday, you know, and vice versa, we could share the work that was done that first meeting date with the people that could attend the next date.
That, or could it be video taped or something so that the others could listen to it?
Yeah, we
that's
could
the
do that
thing, the
too.
files are too big to send in an email, and that's the problem I'm having.
I have the 18th in the morning from 11 o'clock.
That's getting pretty late in the month, though. That's
Yes,
what I'm thinking.
yeah, that was not offered. That 18th was not offered.
I missed, I had an urgent call in the middle of this. I missed one of the times on Wednesday. Sorry, I'm not available in the morning at all. After 1 o'clock, anything?
The only day after 1 o'clock is on the 11th. That's next Friday. Anytime between 1:30 and 4:30.
That's
Paul is saying he's not available.
okay.
Yeah, I don't know.
Yeah, I normally only work half days Friday. And I don't think I'm available to extend. So there's no other time in the afternoon, anytime next week beyond, apart from Friday.
Heidi, on Friday, if you and I bumped our meeting, we could do 10 to 11:30.
On Friday?
Yeah,
Which Friday?
Friday the 11th.
This Friday, 10 to 11:30?
No, next Friday.
Next Friday, the
Oh.
11th.
Oh, next Friday.
Oh, next Friday, on the 11th. Yeah.
Oh,
we can
okay.
we can certainly move my thing to the afternoon, Jenny.
Okay.
I
If it
can
works
do
for
that.
people. Paul, could you do that?
Yeah. I can make I can make that happen. Yes.
I can do that. Marcia.
10 to 11:30.
On
Okay.
Friday? Yes.
What day?
Friday the 11th, not tomorrow.
Yes. That works fine.
I can do the 10 to 11 on the 11th.
There you go. Friday,
Okay.
October 11th, 10 to 11:30, and I will send out the Zoom link for that.
Okay.
Okay.
Just a reminder for everybody to take a look at the documents that Jane Ellen sent, that Heidi sent out to you from Jane Ellen, and the link to the budget.
Yes.
Could you just send the link again? So I have myself.
I sent them out to everybody.
Yeah. Can you just send them again, Heidi, so it's at the top of their email?
Resend Jane Ellen documents. And was there something else?
Would it also?
I
Did
think
we also?
Mary had a letter or something. Didn't you have a letter, Mary, that you sent us?
Yes, I did.
That the GCS, yeah, okay.
I did.
Mary's letter as kind of an example, right?
Right.
I think that would be a really good example for us to follow.
And then I would suggest possibly, at least this is how my mind works, if we could just really zone in on our purpose. Now I realize the letter example will give us how they did it, but with what exactly are we want to achieve at the end of the day when the letter is written
Right.
and delivered, just to help me focus, because we can
Right.
talk about a lot of things, but maybe not all those things need to be included in this letter.
No, and that's a good point, because GCSF, tried to cover just those issues that were most important to them.
Super. Okay, well then I will go ahead and send out that meeting and the documents this afternoon, and you can look for that in your email or on your calendars, okay?
Thank you.
Thank
for
you.
the extra effort.
Okay. Thank you.
Thank you, everyone. Have a good day.
Bye-bye.
Goodbye.
Bye-bye.
Bye now.